Welcome to the RSNA Radiographics podcast. My name is Jamie Clarke. I am a radiology resident at UCLA, and I am very excited and honored to share with you insights from my recent publication, The Invisible Brick Wall: Barriers in Medical Student Radiology Mentorship. I'd also like to thank my co-authors for their contributions to this article, including Dr. Melina Hosseini, who is a co-resident with me at UCLA, Dr. Julia Miao, who is a resident in radiology at University of Chicago, and our senior author, Dr. Courtney Tomlinson, who is on the faculty at the University of Kentucky, involved with medical student education, and who is also an esteemed neuroradiologist. This article was a passion project inspired by many conversations that I and my co-authors had with peers and colleagues, as well as with mentors, discussing challenges faced by medical students who are interested in pursuing radiology, as well as challenges that radiology faculty have in connecting with the broader audience of medical students who may be interested in gaining their mentorship in the field. This article also arose from a realization and acknowledgement that medical student involvement in radiology as a field and in radiology research specifically has been historically low compared to other comparable medical specialties, such as internal medicine and general surgery and many others. The limited involvement that medical students have in radiology research relative to other fields is multifactorial, and the goal of this podcast today and the goal of this article, which I hope you all are able to read at some point in Radiographics, is to really go over some of the key factors leading to these issues from both the trainee perspective and the faculty perspective, and also touch on potential solutions. The idea for this podcast is essentially that there's a sort of invisible brick wall, if you will, a barrier that stands between medical student trainees and radiology faculty mentors. In order for medical students to be effectively mentored and radiology faculty to effectively engage with medical students, in order to create a more facilitated process for medical students entering the field of radiology, this invisible brick wall needs to be seen and identified, and it needs to be knocked down and overcome so that there can be a more seamless process to help medical students achieve their goal of entering this incredibly impactful and special field of radiology. To start, I'd like to take a look at the trainee perspective and touch on specific issues that the trainees face, as well as challenges that they have, and reasons for why it may be more difficult for them to engage with radiology mentors and radiology research than other comparable specialties in medicine. From the trainee perspective, a lot of medical students are not able to have close contacts with individuals who practice radiology. Thinking about the origin of this, I've come to realize that it may stem all the way back to the preclinical years of medical school for students. When students enter medical school, they enter preclinical curricula with the goal being to really gain a strong foundational knowledge of anatomy, pathophysiology, pathology, microbiology, pharmacology, clinical practice in a greater sense, and much more. This preclinical curriculum is typically structured to really give people a broad sense of medicine, so that way when they go into their clinical rotation years, they have a strong foundation in all of the different realms, and they can delve more deeply into the actual logistics and workflows of various specialties, as well as the pathologies and different clinical scenarios that clinicians and patients work to overcome together within their respective fields. The preclinical years at most medical schools, unfortunately, are gravely lacking in radiology-specific content. Not only that, but there is very rarely an introduction for medical students to the workflow aspects of radiology that allow them to understand the job market, lifestyle benefits of both diagnostic radiology and interventional radiology, and really, more overarchingly, the way that radiology fits into the medical realm and the way that it fits into the process that physicians go through as they're working up their patients and trying to find diagnostic answers and best practices and treatment approaches for their specific patients who may present with varying pathologies. Without radiology being integrated into the core curriculum, it's very hard for medical students who don't have prior exposure or knowledge of the field of radiology to even picture themselves doing it for the rest of their lives, or even understanding how it fits into the context of their workflow overall. This is also a bit of an issue for people pursuing any other specialty because every specialty in medicine at this current time, this podcast is being recorded in April 2026, and at this moment in time, just about every patient that needs a diagnostic workup will get some sort of imaging study at some point. And for medical students to not really know how radiology fits into the clinical scenario, in the opinion of myself and likely of my co-authors, is a bit of a missed opportunity where the overall sort of development of medical students could be expedited and more effective if they were to really understand the context in which radiology plays a role in the care of patients. Going back to medical students who want to pursue radiology, not having these close contacts or people that come and lecture them with whom they can then forge relationships and set up shadowing or research opportunities, it really limits the chance for medical students to engage from the get-go with the field itself. Since radiology, in a way, provides a consult service to patient-facing specialists and is not in and of itself patient-facing, this also makes it challenging for medical students who don't have family members who are in the medical field to understand, since up until medical school, some medical students may have only had exposure to the medical field by maybe a smattering of shadowing in college and otherwise exposure through the patient perspective from being a patient going to their doctor's office, their pediatrician's office as a child, what have you. And so because medical students may have never met a radiologist before, it doesn't tend to be on their radar from the beginning. And integrating radiology education into the core curriculum in the preclinical years would be a really phenomenal way to increase exposure earlier on and give people more opportunity to see out potential avenues for research and really explore the field more to think about whether it would suit them well as a future career choice. Another reason that radiology may feel a bit challenging for medical students to pursue is because historically, the amount of men in the field and the sort of relative homogeneity of the workforce has made it so that some trainees that may be of diverse perspectives or trainees who are women, like all of us authors on this paper, may find it a little bit more challenging to find role models in the field with whom they resonate and with whom they can connect to develop mentor-mentee relationships. A phenomenal way to bridge that issue is to get involved with more national societies and various mentor-mentee programs. For example, the American Association of Women in Radiology has a really wonderful mentorship program that allows medical students to be connected on a national scale with radiology residents and fellows and attendings, and really acknowledging the fact that at any given institution, a medical student may not feel as comfortable approaching certain faculty, and really trying to help create a plan to facilitate more ease of networking for medical students can really help to decrease the intimidation that some medical students face when considering wanting to explore radiology further. On that note, another reason that medical students may be intimidated to reach out to mentors in radiology stems back to the hierarchical nature of the medical training system. In certain fields where medical students are pre-designed to rotate as clinical year medical students, for example, cardiology or obstetrics, medical students may be integrated directly into a team in which they need to work daily with, for example, an intern, maybe a second or third year resident, maybe a fellow, and an attending, who all sort of integrate themselves together into one big team to collectively help the patients under their care. This allows medical students to sort of bridge their sort of outreach by talking to people who are closer in age and closer in training stage to them first, and sort of getting a sense of the field from relative peers before going on to people who are full faculty and discussing the field with them. In radiology, a lot of training centers and academic centers have a system in which residents and fellows are really deeply ingrained in the process of their own learning and their own clinical growth. And also, they're studying for board exams, they're taking up call shifts, and many other time commitments that sort of preclude them from getting to engage very much with medical students. This makes it so that any medical student at the majority of academic centers in the country who wants to really get in-depth, multi-year longitudinal mentorship from a radiology mentor needs to go directly to a full faculty attending physician. That can be very intimidating for a medical student, and understandably, it does deter some people from reaching out and getting that sort of mentorship. Additionally, full faculty, of course, have their own high clinical demands and demands to be teaching residents and fellows and working on lecture material or research projects or grant applications, whatever it might be. And because of this, voluntarily mentoring medical students may just not fit into the sort of picture of their work week and the workflow that they have set up for themselves within their role in the institution. This really stems down to the fact that the system is not set up very well for medical students to receive thorough and longitudinal radiology mentorship at any given academic center. Once again, I personally think that this is a bit of a missed opportunity because integrating medical students from the get-go, helping them understand how PAC systems and workflows work, helping them understand different imaging modalities, and maybe even giving them the knowledge and empowerment in understanding imaging modalities to be able to suggest it when they're on clinical rotations and helping them to optimize different imaging orders for patients. All of this knowledge can really go a long way in facilitating quicker growth and more effective integration into the field for medical students so that by the time they start their first year of residency, they're really ready to hit their ground running. In order for this to be the case, it seems like the systems that are in place need to potentially be modified a little bit to really put more value on mentors taking the time to mentor medical students, maybe having residents and fellows be assigned to mentor medical students during certain rotations so that medical students can also get direct exposure and more effective interaction with people that are closer in training stage to them. And overall, I think that having a system in place to mentor medical students from the get-go can really help everybody from all angles. The next issue I'd like to address within the context of medical student radiology mentorship is mentorship in research. So from the trainee perspective, research is increasingly very important for their residency application, and they're also just their general future career development. The number of publications that many young physicians have is increasing year by year, and the expectation for publication for academic career advancement is growing higher and higher. Additionally, in the current time, so again, I'm recording this in April 2026. In this present day, a lot of the admissions for radiology residencies has shifted a little bit further from focusing on board exam scores and much more towards looking at research productivity, mentorship letters of recommendation, and engagement with leadership roles and even national roles on different committees. Therefore, having a really strong foundation in research from the beginning of medical school can give medical students a huge advantage and push in being able to gain momentum in research, being able to do projects that are more longitudinal and comprehensive and hopefully have really high clinical value, and allowing medical students to really grow and develop with their research project as opposed to being added onto a project or just doing things for the sake of their CV alone. Of course, it's really great that research requirements exist because we need research in order to advance the field and to be able to innovate, for example, a new way of using certain MR sequences to better elucidate certain pathologies, or advancing the way that we use an AI tool to be able to detect something with a higher sensitivity or specificity within a chest X-ray. These types of research advances ultimately allow for patients to get better care and for us as physicians to do the best job we possibly can. And so, within the context of medical students wanting to pursue research in radiology, it is important that systems are developed and are streamlined and are put into place to really help facilitate that opportunity for them. When thinking about the trainee perspective in seeing barriers to achieving radiology research mentorship, this again is a multifactorial issue, but one of the key reasons that this is challenging is because for a medical student to be involved with radiology research, it not only involves them needing to have a phenomenal understanding of anatomy, disease processes, and whatever else is related to that particular research question, but they also need to understand ideal imaging modality selection to evaluate that particular disease process. They need to understand the technology involved with the radiologists who are reviewing the imaging. They probably need to understand the radiology workflow to an extent. And for more informatics-based projects, they might understand the underworkings of the PACS system, the underworkings of the dictation software, or whatever else they're studying. And also understanding the way that radiology reports are crafted tends to be important if a medical student, for example, is reviewing a cohort of cases and looking at the language in the reports for that type of research. Therefore, a medical student has to really go above and beyond and not only excelling in their standard medical school curriculum, but also self-learning this entirely additional curriculum that really isn't expected of them at the medical student level. With that being said, many students who pursue radiology but know that they need to perform research as medical students may find it to be easier and less work to pursue research in other clinical specialties simply to avoid having to do all of that extra learning and extra voluntary acquisition of knowledge on top of their already large quantity of knowledge that needs to be absorbed as a medical student inherently. In order to overcome the challenges such as what was just described for medical students to really effectively be able to be involved in research, there need to be intentional efforts that cultivate structured, accessible mentorship programs and career development programs within medical schools and institutions to really help medical students along in their way if they choose to take on these tasks and they are passionate about really jumping into the field of radiology from the start of their medical career. At this point, I'd like to briefly go over Table 1 from the article. For anyone that is following along with the article, feel free to take a look at this table. And for anyone that's listening, no need to worry because I will verbally explain what the table shows. The table from this article goes over the opportunities for medical students to engage in radiology and specifically in radiology research. So I'd like to briefly just summarize some of the key points from the table that can help both medical students interested in radiology who may be listening to this podcast, as well as potential mentors who may be listening to this podcast who would like to guide medical students who approach them on actionable steps to be able to effectively engage in radiology and radiology research at the medical student level. First, let's go over actionable items for radiology research preparation. For proactive medical students that would like to do research in radiology, it's very important to start fundamentally with completing any HIPAA training that is provided by your institution. This involves familiarizing oneself with patient privacy regulations and data protection laws. Once that foundation is set, another really great thing that medical students can do to better understand how they can effectively contribute to research is to look at the literature. Studying research methodologies from articles that they're interested in can help them understand both research design and also how to construct a medical research article with a radiology-centric focus more broadly. Reviewing the medical literature can also help people stay updated on current trends and methodologies in the field and inspire them with ideas or papers that can sort of piggyback off of what the literature has recently been saying and keep those trends up to date. Shadowing within one's radiology department can also help a lot for medical students, especially early on, with learning just basic imaging interpretation processes and techniques, and starting to get a grasp on different modalities that are used in radiology so that when the medical student begins a research project, they have a really nice foundation in understanding the basic inner workings of radiology as a field. On that note, learning image reviewing and viewing basics such as different search patterns, windowing techniques, and basic radiologic principles is really great. And there are plenty of YouTube videos out there, plenty of videos on other platforms that are specifically designed to help medical students and residents learn the basics of radiology. So taking the time to look at some of those can really help give you a leg up when it comes time to actually start doing radiology research. Attending radiology lectures and seminars can also be helpful, especially lectures that are directed towards residents, since they may be more digestible for the medical student level participants to take in. Also, networking and building relationships with faculty members and other residents and fellows at the institution can be really helpful. Joining radiology interest groups is super great as well if they have them at the institution at which the medical student is attending, or even national radiology interest groups. Workshops can also be really helpful, and this doesn't have to be just for radiology, but this can really be focused on any sort of workshop that goes over research skills, statistical methods, and data analyses. Radiology is a completely data-based field. It's imaging data, it's imaging acquisition, it's linguistic data in the form of the reports. And so understanding how to perform effective data analyses as a medical student gives a huge advantage to anyone that wants to do research. If you can learn R or SPSS or SAS or any of the other softwares that are used for data analysis, it can provide you as a medical student or your medical student mentee, if you're a faculty member listening to this podcast, with a huge opportunity to serve a research team and be of value to a research team, because at the end of the day, research is rooted in data analysis. Another thing that medical students can do if they want to be very proactive is develop a research protocol and research proposal. And this doesn't have to be granular. It can be just a sort of general idea. But for a medical student to go to a faculty member who they know is specializing in a particular area and say that they have this research idea or general research topic that they'd like to pursue, they can really help get things moving quickly and help people to build some quick momentum when it comes to developing a project and really getting into the details of acting out the project and being able to write up a manuscript or put together a conference presentation for that research. The next section of the table goes over types of research studies that medical students can perform. And this is by no means a comprehensive list, but hopefully this will give you as listeners some ideas of ways that medical students can effectively engage in research and take on particular types of methodologies from the get-go. So quantification studies are a great option for medical students. This involves measuring specific parameters on radiology images and exploring correlations and outcomes. This is something that could be tedious to some, but it will ultimately lead to a large data set if done correctly and can have a lot of clinical insight if done well. So it is something that for a dedicated medical student can be a great approach to performing research. Another approach is the literature review project, and this is nice because it typically doesn't require very much patient record access or PACS access and can really be done on a medical student's own time. So this involves conducting meta-analyses or writing review articles, and through these types of methodologies, you can synthesize existing research on a topic. A specific type of review project that I've personally performed a few times and have found to be very insightful and also just something that was very doable as a medical student is to conduct a type of meta-analysis called an individual participant data meta-analysis. And this process is essentially where you pick a rare disease for which numerous case reports have been published, and you synthesize data based on those case reports to provide a sort of pseudo-cohort analysis of a particular rare disease process if no cohort study has ever been published on that process. And this can end up leading to the researchers doing that project producing a lot of data, and you can really derive some valuable insights, once again, without having to have access to medical charts or records, since all of the case reports that are in the literature are already made publicly available. Another potential research approach is the bibliometric analysis, which involves analyzing publication trends or citation trends or research output in a specific field. Medical education projects are a great way for medical students to engage as well, and this is assessing educational strategies and their impact on learning radiology. Other options include performing survey-based projects, case studies or case reports, or quality improvement projects. And quality improvement projects may be projects related to operational efficiency that a research group might want to publish, but it can also really just be internal projects within the department to help optimize the way that that department is running or that those softwares available to the department are being used. And especially for students that might be interested in staying at their own institution for residency, doing those sort of internal quality improvement projects will likely bode favorably for them and will be appreciated by the staff and the faculty at that institution. And hopefully the student can leave a positive mark in their department by doing something along those lines. The last part of the table goes over types of platforms for gaining research experience. So just briefly, this includes conferences, which within the context of radiology, conferences that welcome and have specific content for medical students include RSNA, AAR, ARRS, and many others. Also, journals often welcome medical student research, such as the Medical Student Research Journal. There are journals such as the Radiology Case Reports Journal and many other types of journals that accept radiology case reports and radiology articles, all of which welcome medical student authors. Joining professional societies as a medical student is also a very underrated but highly beneficial opportunity, and most times these professional societies will have significant fee reductions for medical students to be able to join. And certain societies, such as RSNA, have medical student task forces, which is another really great way for medical students to engage not only with the society, but also with their peers on a national scale. Some medical students may be interested in pursuing research internships in radiology departments, and while those are a little bit hard to come by, they are out there if people search and find the right opportunity, and it could be really a phenomenal way to grow your career and your understanding of radiology as a medical student. There's also plenty of online courses that students can pursue, not only to learn more about radiology, but also to learn basic medical research methodologies and statistical methods, which once again make medical students a huge asset to a research team if you know how to do statistical analyses well. There's also collaborative platforms like ResearchGate that let people connect on a national scale, and different specific mentorship programs, such as the ACR mentorship program for medical students, the AAWR mentorship program, and so many others. I'd like to transition now to briefly talking about the faculty perspective on medical student radiology mentorship and the barriers that faculty face in achieving opportunities for effective mentorship. I've alluded to some of these barriers earlier, such as that faculty may not have enough devoted time built into their weekly schedule to be able to give medical students their full attention and in-depth mentorship. But other barriers include the fact that medical students may be in the midst of clinical rotations and exams and preclinical coursework, and radiologists just don't have a way to directly engage with them unless their medical students are placed in front of them in the reading room. This once again stems back to the fact that radiologists are a sort of consult service where they provide feedback essentially based on diagnostic imaging workups to referring providers and obtain information about patients from referring providers. This takes medical students and the medical student work that's done during the clinical years out of the direct field of view of radiologists and radiology faculty in specific. As such, the onus is then put on medical schools to put medical students in situations where they are allowed to interact with radiology attendings so that radiology attendings can continue to go about their typical workflow, but also have medical students available to them with whom they can engage, teach, develop mentor-mentee relationships with, and discuss potential research opportunities with. To summarize this podcast, mentorship in radiology is a vital component for faculty to grow professionally, for medical students to gain the experience that they need to decide on a career in the field of radiology, and for research to be pushed forward by both faculty and medical students in collaboration. Without systemic and medical school and departmental-based intentional efforts and changes to the system, there may continue to be a sort of invisible brick wall, if you will, that stands between faculty who would like to be mentoring medical students from the start of their education and career and medical students that may potentially be highly suitable for the field of radiology. With systemic changes and with a few small steps taken by medical schools, and radiology departments to ensure that more intentional and effective engagement can happen between medical students and radiology faculty, there could potentially be a big swing in the number of medical students that are interested in pursuing the field of radiology, the amount of research productivity and research advancement that can occur by motivated and hardworking individuals that want to collaboratively advance the field of radiology. And the advancement for faculty can also continue to improve as faculty who engage in teaching activities, engage in mentoring, engage at the medical student level can find a lot of fulfillment and also ways to grow their academic reach within the field. It is my hope that this article allowed for you all as listeners to be inspired about the potential that the field of radiology has to grow and develop and really foster a mindset of continuous improvement, and that overall, taking some steps that were suggested through this paper to break down that invisible brick wall between mentees and mentors would allow for the field of radiology to become stronger and for radiology to see a very sustainable future. Thank you so much for taking the time to listen to this RSNA Radiographics podcast. I would like to encourage all of you listening to rate, review, and subscribe to the podcast. You can also go directly to the Radiographics Journal website to read this article and so many other phenomenal articles and editorials. And thank you all so much for joining. Have a wonderful day.